Good evening, everyone, and welcome to our 5th annual World Heritage Open House. We're trying something new this year. We want everybody to stay safe. So I hope you enjoy tonight's presentations. We will take questions after the presentations, and we'll be back tomorrow evening and Wednesday evening at the same time. And now I'd like to introduce Councilwoman Rebecca J. Villagran, who will kick off our World Heritage Open House tonight.
Good evening, everyone. This is Councilwoman Rebecca Villagran, Councilwoman for District 3, the South and the Southeast side of San Antonio. As you can see and tell, we are doing things differently this time around with our World Heritage House virtual. And with it comes different challenges, but we are up to the task, and we are so grateful that you are joining us for our 5th annual World Heritage Open House. I want to thank my team and the Office of the World Heritage Office for coming together creatively for this event. This is the first night of 3 nights that we will be hosting this World Heritage Open House to give you updates and information of what is going on in our community, all while keeping you safe at home. So again, thank you so much for joining us. I want to share with you that there are a couple of ways for you to participate tonight. The first is that you can drop your comments and questions in the YouTube live stream comment section.
Yes, and after that, I'll introduce.
You can also call us at 210-207-2111. You can also text message us at 210-262-0025. Or you can email us at worldheritage@sanantonio.gov. Please know that we are continuing, even though things are very trying right now. We know that we have some challenges in our city budget, and we know challenges happening throughout the city. But we are going to make sure to follow through on the work that we need to do here in the city. Tonight's program focuses on city services and response programs available during our current health crisis. Joining us from various areas are going to be the Department of Metro Health, also the Department of Human Services, as well as representatives from the Neighborhood Housing and Services Department and from the Economic Development Department. Again, thank you for joining us this evening. We appreciate your patience and understanding. And should there be any delay during this live stream and telecast, which we've already experienced, thank you for your patience, and we're going to continue to move through this. So at this time, I'm happy to introduce our first presenter, and that is Carol Schlesinger from Metro Health.
Good evening, I'm Carol Schlesinger, doing a presentation on behalf of Metro Health, and our presentation will deal with COVID-19, where we are right now. Let's start with the situation in the United States. We have, unfortunately, more than 2,250,000 cases confirmed, and over 120,000 deaths at this point. In San Antonio and Bexar County, we have 6,882 cases and 97 deaths. We've had an incredible amount of increases in cases over the past 4 to 5 days. And as you can see, we break down the case classification into 3 different categories, whether it's travel-related, close contact, or community transmission. And not each case has the same amount of weight. For example, a travel-related case is one that is acquired from someone traveling abroad or traveling to another part of the country. That means that they were bringing the transmission and importing it into the area, right? It used to be that was the majority of our cases when we had no transmission. And then you have close contact. And travel-related, we're only at 4%, and that's going to continue to decrease. Close contact is when two individuals spend an amount of time anywhere from minimum 15 to 30 minutes without a mask, without social distancing, and that transmission happens within that close contact, correct? Then we have community spread. That's the kind of case you really don't want to have. We have to do contact tracing when we have community spread, community transmission, and we want to make sure that that is contained and controlled. So, for example, when a person tests positive, we have to call that person and talk to them. We usually do about a 1 hour interview with them, in which we determine for the past 14 days who have they been in contact with, and then we contact those individuals additionally and talk to them to see if they will be tested. That's how we do our investigations, like a spider web into the community. And sometimes with community spread, we are unable to do that. So we want to try to reduce those number of cases as much as possible. And then, of course, you can see that we have 32% of our cases under investigation. That's when they go through the process of classification, whether they're travel-related, close contact, or community transmission. Let's talk about precautions and symptoms. As you know, COVID-19 is spread through droplets from talking, sneezing, coughing, even aerosolized droplets when you have your mouth open. So a number of ways that can be spread. In addition, you can spread them through close contact and through touch, right? That's why you hear all the time, wash your hands, because on a cold metallic surface and other surfaces, that virus can live for a period of time. And when you touch that surface and then touch your eyes, touch your nose or mouth, you can expose yourself to that virus. How do we reduce that risk? So we prevent it by washing our hands, again, to prevent that touch transmission, avoid touching our eyes, nose, and mouth, and cleaning, disinfecting surfaces to prevent that touch transmission. But we also wear masks. We avoid close contact with people who are sick, and we stay home if we're sick to ensure that we're reducing the droplet transmission, right? When we first become sick, that's when we have the highest viral load. Viral load means the most amount of virus in our system. So that's why you hear, please stay home if you're not feeling well, because that's usually when you have the highest viral load and when you're most likely to transmit the virus. So who's at higher risk of getting sick? Older adults, people in nursing homes, people with chronic health conditions like chronic lung disease, asthma, heart conditions, obesity, uncontrolled diabetes. And unfortunately in San Antonio, that's a large percentage of our population. How can we prevent that those people at higher risk get COVID-19? We want them to stay at home as much as possible, wash their hands, and practice social distancing. We want to make sure that at all times when they go outside, or even when they have people visiting, they're wearing a mask, and to call their doctor if they're not feeling well. So the symptoms of COVID-19, the two most common are fever of 100 degrees or more and cough. Then we have shortness of breath, body aches, chills, headache, loss of taste or smell, and a sore throat, among others. And it's usually a combination of those symptoms. Not everybody gets all of them, and it's the symptoms may appear anywhere between 2 to 14 days after exposure. So that's very important because you could be incubating that virus for up to 2 weeks. So there's a lot of stuff happening in San Antonio and across the state, across the country. Things are reopening, people are moving more, businesses are increasing their capacity. And fortunately, our testing is increasing. In fact, in the past few days, we have increased our capacity way beyond what we ever imagined, because the demand, as we're seeing an increase in cases, we're seeing an increased demand in testing, and that's a good thing. However, many public health recommendations are still in place. Of course, your mask is essential. Keeping that social distance is going to help prevent that the virus is transmitted from one person to the other, because literally those droplets have to travel 6 feet from one person to the other, and the likelihood of that happening is low. When you're 2 feet apart, that likelihood goes up, right? We also, when we're wearing a mask, we're adding a physical barrier to prevent those particles, those virus particles, to transfer to another person, right? And when that other person is wearing a mask, then that probability is reduced tremendously, even more. And that's why masks are important. In addition, we have pre-symptomatic individuals, meaning they're spreading it up to 48 hours before they become before they become symptomatic. And then we have individuals that are asymptomatic. So unfortunately, we're seeing that the majority of the cases in San Antonio are in people 40 years of age and younger. So the majority of the cases are in young people, yet it's affecting the older people the most. So we really, really, really urge the community to wear those masks, because when an asymptomatic person does not wear a mask, they're spreading it freely across the community. And if they are wearing that mask, it reduces that probability of transmission much, much more. So let's dig a little deeper. Right now, as you know, we're in phase 3. We're easing a lot of restrictions, and we're reopening the economy. But again, we're seeing an increase in cases, so we have to be very strict about our own guidelines, ensuring that if I'm not feeling well, that I'm staying home, that I'm social distancing, and also for the kids. The kids have to follow that as well if they're going to be out of the house with us. So what happens in phase 3? We talked about increased capacity in operations. We have to continue with our hand hygiene and cleaning standards. We want to we're de-escalating some of the restrictions. Like last week, you heard that HEB was not requiring masks. Now they're changing that. But again, some restrictions are de-escalating in how strict they were before. And same thing, we're supporting businesses at this time that perhaps are not meeting those guidelines. We're not telling people, go ahead, reopen, and good luck. We are out there, our code enforcers, our health inspectors are out there making sure that all businesses that are reopening are meeting those guidelines that are set by the health department. We also are seeing a de-escalation of restrictions, perhaps in summer camps, sports camps, pools are opening. So that doesn't necessarily mean that there's less transmission. It means that we have to be more vigilant with our own guidelines and our things that we're supposed to do, right? And of course, we continue monitoring warning indicators. In terms of testing, there's quite a bit of testing in San Antonio. Right now, the Freeman Coliseum is up to capacity through tomorrow, so they will be reopening the registration system, which had been shut down on Saturday, and they will reopen tomorrow. We're adding walk-up locations all across the city. We're expanding from 3 days a week to 6 days a week. And in addition to that, we have the Texas Military Department that has come to San Antonio to assist with even more testing sites. Our testing goal was 3,000. With our partners, altogether, we're testing about 5,200 people a day. So we're making a tremendous effort, and we really want to urge the community that if at this time you are not symptomatic, to leave those spaces, because the demand has increased so much, to leave those testing spots for people who are symptomatic. So we ask you for that. Also, if you do have health insurance, we ask you that you not go to the locations where we are able to help people without insurance. And there's many, 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 including Texas Med Clinic, locations where they can get testing covered by their insurance. So again, if you want a list of all the locations, you can go to covid19.sanantonio.gov, and you can find those testing locations for the public, for people without insurance, for people without transportation. We are making that happen. We do want to remind everyone, please, if you do have health insurance, consult with your doctor or go to an urgent care clinic. Last thing is our screening tool. It's online as well at sanantonio.gov, and it's a great resource. If you're not really sure, if you've had somebody that you know test positive and you want to screen yourself, and you're not sure if you're at risk, if there's a person in between, is there like 2 degrees of separation, this is a great tool for anybody to determine whether they need testing right now or not. So again, if you need help accessing healthcare, we're here for you. We have testing. Testing will be free for those without health insurance. We do not want that to be a barrier for those who need testing. And we know that the virus does not discriminate. So it's the same thing for immigrants and documented immigrants. There is something called the public charge that the current administration has put in place, and that fortunately does not apply to COVID-19. So in other words, anybody or anyone can get tested for free at our Metro Health locations. For more resources, you can go to the Metro Health website. The Department of State Health Services has tremendous amount of resources, particularly for small businesses who are perhaps looking for guidelines on how to reopen, hygiene standards, those kind of things. They're a great resource. And of course, the CDC. So there's 4 other ways that you can stay informed about coronavirus in San Antonio. You can download the Ready South Texas app, available at iTunes and Google Play stores, and it's free. You can also sign up for texts from the city of San Antonio. You can just text COSA.gov to the number 55,000, and you can receive text messages with information about this and much more. You can, of course, follow us on social media and our website. And lastly, our COVID-19 hotline operates 7 days a week. You can see the hours. We're available in English and Spanish, and you can call us anytime. If you don't want to call, you are more than welcome to send an email to covid-19@sanantonio.gov. And that wraps up my presentation. We will take questions at the end. And right now I'd like to introduce Patrick Steck, who is the Interim Assistant Director with the Department of Human Services.
Thanks so much, Carol, for that great information. My name is Patrick Steck, Interim Assistant Director of the Department of Human Services. So I just want to go over quickly a quick overview of what our department does, and then cover some of the initiatives of the COVID-19 Recovery and Resilience Plan that the City Council has recently approved and that our department will be doing part of. So the Department of Human Services has 4 long-term outcomes focusing on children and youth, individuals and families into financial security and housing, stable housing, ensuring our seniors are healthy, engaged, and independent, and that homelessness is rare, brief, and non-recurring. So we do this through several initiatives. Go to the next slide. Success, child or career college opportunity, domestic violence abuse prevention, financial security, senior services, and homeless initiatives, as well as the faith-based initiative that you'll see here. So I'll dive a little bit more into those. Next slide. Within the early childhood education area, we operate the Head Start program for San Antonio ISD and Edgewood ISD for 3 and 4-year-olds, as well as the child care services that provides working and families that are accessing education with child care support so that they can have a safe place for their kids to be while they're in school or working. And then there's a partnership between those 2 programs for our early Head Start with 6 sites across the community. And we're excited to announce soon that we'll have 50 additional slots to support the community for those youngsters. Next slide. A little bit older with the youth services, the City of San Antonio through DHS funds Cafe College. Also our Next Level Youth Opportunity Center, which is for 16 to 24-year-olds to get connected back with employment or get connected to school if they've dropped out. A number of resources there at Next Level. The San Antonio Education Partnership, which funds a scholarship program for high school students. And then the Ambassador program is an internship program for youth that are in college. Unfortunately, something that's suspended this year for COVID-19, but we hope to get back again next year. Next slide. In the area of financial security, we operate financial empowerment centers, and I'll talk a little bit more about that in a moment. But to help with household budgeting, those common financial issues, and helping people with making sure their credit report is clean, structuring their debt, things like that. The VITA program provides free tax preparation, income tax preparation during tax season. You still have a few more weeks to file your taxes. The deadline was extended this year to July 15th. And that program is still operating through the telephone-based service. Utility assistance program provides emergency assistance with utility bills. And the Training for Job Success program provides workforce training and supports for families to help them get into high-demand, high-paying jobs. Next slide. Our senior services, we operate 10 comprehensive senior centers across the community serving about 30,000, or excuse me, 25,000 seniors every year. Seniors can get a daily nutritious meal. They have social connections when they're open, and fitness and wellness activities. Currently, of course, we've had to change operations as everything has with COVID, and we've continued, fortunately, to be able to provide those daily nutritious lunchtime meals twice a week to our seniors. Next slide. And then in the area of homeless prevention, we work closely with Haven for Hope, funding the emergency shelter work that they do, as well as getting folks into permanent housing. We work closely with a veterans collaborative that does special outreach to those who have served in the military and are experiencing homelessness. And the San Antonio is proud to have effectively ended veteran homelessness by providing a number of supports to get folks off the streets quickly if they're experiencing homelessness and are veterans. And then finally, the Homeless Encampment Initiative is a coordinated interdepartmental group that does outreach to homeless individuals and addresses any encampments that are posing a health and safety concern to our community. Next slide. Within DHS, we're also proud to have the faith-based initiative. This is a relatively new effort over the last few years to connect faith communities and congregations who are already doing a lot of great work in the community, bringing them together in a number of working groups to leverage and build that network of support for our community that's in line with the mission of DHS and the mission of the city as a whole. This is also part of Compassionate SA initiative to make San Antonio a compassionate city. Next slide. For several different programs in community nonprofits. So we provide funding to about 64 nonprofit agencies who are located here in San Antonio, doing work here in San Antonio. A number of programs you may be familiar with, whether it be at school districts, the YMCA, wide range. You can see 94 different ones, and they're aligned with homeless seniors and workforce areas. Next slide. So that's a quick overview, very quick overview, and I'll be glad to take questions of any of the department's programs. But these next two slides are related to the Community Recovery and Resilience Plan that City Council recently approved. So we will be soon expanding the Family Independence Initiative's Up Together program, which is a program to work with 1,000 families to help them increase their income over a 2-year period. Look for more information about that, but it's something we're very excited to soon provide, with a set of social networking for families, access to resources, as well as small direct cash to help folks get through any crisis that they may be experiencing. We're funding additional childcare support for families that are accessing childcare that are also enrolled in job training programs who may be looking to get retrained. We're soon going to open next week the Virtual and Place-Based Financial Recovery and Resilience Center as a one-stop shop for folks who are needing help with financial counseling, with benefits enrollment, maybe unemployment, SNAP, or CHIP. And they'll also be connected to our emergency housing program that Vero is going to talk about next. We'll also, through that hub, through that center, connect residents to low-cost financial products, things that like low-cost checking accounts and refund anticipation loans. So if you're still looking to get a refund on your taxes, we can do that and help you get it quickly without paying loan fees that are excessive. Next slide. And then the last few components of this recovery plan related to COVID are additional homeless shelter options to assist Haven for Hope and those that are working with the homeless to ensure that everyone has access to shelter. We're going to be doing some door-to-door engagements, so you'll see folks on the streets going block to block, door to door, sharing the information about these services that are soon coming online that are directly looking to help folks affected by COVID-19 with recovering over the next several months. And then finally, a digital referral platform, which will help our nonprofit organizations coordinate better in the delivery of services, something that we've long talked about and are finally excited to be doing. We know that will benefit many families in this long recovery. So that does it for the Department of Human Services. And again, be happy to answer any questions at that presentation. But I'll next hand it to Veronica Soto, who's the Director of Neighborhood and Housing Services for the city.
Good evening, buenas tardes. I'm Veronica Soto. I'm the Director of the Neighborhood and Housing Services Department. So our department addresses housing issues, and what I want to focus on is our emergency housing assistance program. And I'm excited to tell you that we know many in our community are having financial difficulties because of the stay-at-home orders and many jobs that have furloughed people, have laid off people. And so our emergency housing assistance program was created in response to that financial situation. So what I want to walk you through is what our program offers. The next slide shows what started our program. We started with the risk mitigation fund that the city has had for over 2 years, where the city invested $1 million out of the general fund to help families who were having difficulty staying in their homes as rents were rising, for example. We had foresight to include emergency housing assistance as part of this program because we know that many in our community were one paycheck away, one doctor bill away, one very expensive car repair away from not being able to make the rent. And so that was the foundation for our program. And out of that policy that we had developed with a lot of community feedback, we saw that it was going to be important to continue to provide emergency housing assistance. In March, we went from getting 53 calls a week to over 5,000 calls a week because people were worried about how they would make the rent. And so the graphic shows you what the volume of calls started to become. And so we presented to Council on April 23rd the COVID-19 Emergency Housing Assistance Program. It has the same eligibility criteria as the risk mitigation program. It helps families at or below 100% of the median income in our city. That means anyone at the middle, median means the middle, anyone making below the median income in our community is eligible for that program. To me, that means half of our citizens, half of our residents can participate in this program and request help. And so what the program does is it covers the rent or the mortgage for families that are having financial difficulties because of the pandemic for up to 3 months. The maximum allowed assistance for rent or mortgage is $3,500. Again, that's looking at combined 3 months. We also cover utilities. It's the light, the electric, but we also know that internet is another utility expense that we have. With many kids being at home, we thought that would be something else that would be covered. So again, 3 months of utility assistance, maximum is $1,500. And we added a direct cash component because we heard that people are wondering how they're going to get gas for their car if they had enough money for groceries. And so based on family side, there's up to $300 in direct cash assistance that is being provided to our clients. And so this is the program that we created back in April of 23rd, and we have gotten a lot of families to apply. Again, the maximum is $3,500, $1,500 for utilities. A little bit more assistance is provided for families that make slightly less, but you can still see that half of our citizens are able to apply for this program. And you can see the cash assistance. One single family member can get $150, and the cap is $300. And that is in the form of money deposited into a bank account or a prepaid debit card that gets mailed to the family. The source of funding for this program was a combination of federal funds as well as local funds. And the local funds were important because we wanted to make sure that families that were not eligible for federal federal funds. We have many immigrant families in our community, some of whom do not have their citizenship status clarified, have family members that are undocumented. We can still help those folks. And so the program has local money that can help undocumented families also stay housed during this unprecedented time. So the program is off and running. The application is available online, and there are ways that someone who does not have access to internet can still submit applications. We have other partners, and in our office, we're taking applications, helping clients fill them out if they need to. And just this month, we announced that out of the additional federal money that the city received, we're continuing that program and adding an additional $25.6 million, so that in the end, we're going to have $50 million to help our families stay housed. And that's part of our recovery and resilience plan, and it is part of the housing pillar that will help us as a community recover and be resilient. And so that's what I wanted to share with you, because during this time, we know some of you may need this assistance so that we can continue to stay safe in our homes. And I'm happy to introduce the next speaker, who is my colleague from Economic Development.
Sorry, I'm having trouble hearing here. Hi, everyone. Thank you. This is Ann Eaton from Economic Development. I'm happy to be here. Thank you for inviting us to share a little bit about what our department does, and then also talk about some of the COVID items that we're working on. So next slide, please, Rogelia.
Before that, Ann, can you?
Workingly, our department has 4 divisions. We're broken into workforce, international relations, industry, and then of course, small business office. Our small business office focuses on trying to work with businesses in our cities to get access to city contracts. We work with partners to provide technical assistance through 2 key programs known as the Mentor Protege Program and Launch SA. And then lastly, we work with LIFT Fund and house the loan interest buy-down program and provide business fee waiver. Next slide, please. SBATA is probably one of the most known. That's the acronym that stands for Small Business Economic Development Advocacy Program. So this is what the city uses to promote the use of local, small minority, and women-owned businesses in city contracts. SBATA is available through city ordinance, and so it allows us to place specific goals on city contracts to utilize businesses that are designated as local, small minority, or women-owned, and for contracts that are over $50,000. So there's 3 steps to qualify. 1, a business must be certified with the South Central Texas Regional Certification Agency. 2, be headquartered in San Antonio and have significant business presence here. And then lastly, be registered as with the city of San Antonio. We are happy to walk any business through this process. Please reach out to our office on the city's website, or you can go to sanantonio.gov//EDD or /SB as in boy O. So just an example of the success of the SBATA program, and every year we publish an annual report to indicate our goals and how we're performing and how we're utilizing small businesses and minority and women-owned businesses on city contracts. In FY and fiscal year 2019, we were able to spend 57% of all dollars of city contracts on local, small minority and women-owned businesses. This is just a graphic from one of our major milestones. You can see there $253 million, which is the highest that's been paid to date since the program was established and overhauled in 2011. Next slide, please. I mentioned the partnership with provide technical assistance. One of those key partners is through Alamo Colleges. We administer what's called the Mentor Protege Program, which that helps businesses in building capacity. So it really has 2 functions. The first one is to educate small business owners through a series of business courses. So there's courses in like QuickBooks and access to capital, contracting, So there's about 10 to 12 courses per kind of segment of time, and that you're allowed to go and participate with the instructor and get that education component. The second part is you're paired up with a firm with a mentor program once a month, but that's really to kind of have contact, reach back, business grow. We're excited to share that applications for fall 2020, the Small Business Bootcamp, are open. This year, cognizant of the safety precautions due to COVID, Alamo Colleges has worked with us, and they're going to provide .gov/. We partner with between community development, financial inside this business and entrepreneurship. They have a various number of programs in business at different business entrepreneurs to those that have been established and just looking to learn how they can either grow their business. They've done a ton of pivoting with all the challenges from COVID, and again, cognizant of that safety precaution, and hosting a lot of their information sessions in this virtual space. So if you're interested in learning more about Launch SA, again, their physical space is not open now, will be probably closed as we receive guidance from leadership, but you can visit their website at www.launchsa.org to learn more. Next slide, please. So our economic development department is working also to administer funds that have been provided through the CARES Act. We have two components of the 4 pillars that were adopted by council on June 4th. Our department is working 2 pillars, small business, which provide up dollars of the workforce piece, which will provide to present this off by the council committee, and we work in the recommendations. We'll be able to get that out to the community. Next slide, please. Tax sheet. I'm one assistant director. She would email, social, where can, and that concludes.
Well, good evening. That includes today's first round of presentations. We will be back with you tomorrow evening at same time at 6 o'clock. In the meantime, I believe we had a few questions that we would like to get answered. So let me see what those are. One question, this is for Patrick. Patrick, are you still available? We have a question for you. The question is, when will senior centers fully reopen?
Yeah. So, Metro Health and city management.
Over? Can you start over?
Yes, sure. So we're monitoring the COVID before we make any decisions about reopening senior centers or any services. I know a lot of seniors are really to get back to their friends there. In place before reopening. It is probably going to be a while, unfortunately, and the inherent safety risks of activity at the senior center. When seniors return, we are able to reopen. We'll have but we are excited to one day reopen and see everyone again. I know that our staff have seniors just as much as they're missing coming in, but be a little while
Okay, thank you, Patrick. We have another question. When will the presentations be made available on the city website? We will do that after the 3 days of presentations. We will put them all on our city website. Tomorrow we'll also have some surveys and things of that sort, so we will make them available before the end of this week. If you have any more questions, you can call us at 210-207-21111, or you can text a message to 210-262-0025. You can also email us at worldheritage@sanantonio.gov. And don't worry, since we have limited time, if you're not able to get your question in this evening, please send one anyway, and we will make sure that we provide a response to you.